Hello, everyone. My name is Robert Bednarz, and I am a junior doctor in Dundee, Scotland, and you're listening to the Patient Will See You Now podcast. I have to say, this podcast is for educational use only, and you should not be using this as medical advice or opinion. Please go see your doctor if you have any medical questions. This podcast is supposed to be fun and educational. So now that I got that out of the way, let's get into this week's topic. Hey everyone, this is Robert, and I'd like to first start off by saying that this episode of the Patient Will See You Now podcast is proudly sponsored by the MDU, or the Medical Defense Union. Hyper IgE syndrome is a pretty rare disease, so I was excited when I found out that someone wanted to be a guest on the show to talk about having it. There are many different types of hyper IgE syndrome depending if it's autosomal dominant or autosomal recessive in terms of genes. But the one that's more common and also what this guest has is the autosomal dominant one, and it is also called Job syndrome. The two names, hyper IgE syndrome and Job syndrome, will be used interchangeably in this episode, but just remember that there are many different types of hyper IgE syndromes. The reason why it's called Job syndrome has a biblical history to it, where Job was covered in boils by Satan to see if Job would lose faith in God. In hyper IgE syndrome, one of the symptoms of having it is severe eczema and even skin abscesses all around the body. But before I go into what hyper IgE syndrome consists of, let's talk about what IgE is. IgE is also known as immunoglobulin E, which is an antibody and is one of the 5 immunoglobulins. You also have immunoglobulins M, G, A, and D. IgM is present in an immediate response to some invaders like viruses or bacteria in the body. IgG is the main antibody in a delayed response in an infection and helps certain white blood cells eat up the invader. IgA makes sure that the invaders don't attach to mucous membranes in your intestines. And IgD, well, we're not really sure what that one does yet exactly. IgE is the main antibody we see when someone has some sort of allergic reaction and binds to certain cells in the body to help with attacking the allergen. When someone has any kind of allergic reaction, these IgE antibodies will be markedly raised in the blood. Hyper IgE syndrome is a rare primary immunodeficiency disease characterized by recurrent eczema, skin abscesses, lung infections, eosinophilia, and high serum levels of IgE. Additional findings in people with hyper IgE syndrome include skeletal and connective tissue abnormalities. For example, people with Job syndrome have a typical facial characteristic, which have an asymmetrical facial appearance with a prominent forehead and chin, deep set eyes, a broad nose, thickened facial skin, and a high arched palate. These features evolve during childhood and become more established by adolescence. Other features are hyperextensibility of joints and not being able to lose their baby teeth on their own. The reason why people who have Job syndrome have recurrent skin and lung infections is because their T cells, one of the types of white blood cells we have in the body, lose their function to call for backup when they bump into a virus or bacteria. And that's because of a decreased production of interferon gamma, and that's because of a mutation of something called the STAT3 gene, STAT3 gene. And that's responsible for, to put it as simply as possible, getting the backup the body needs to fight an infection. A healthy person that doesn't have this mutation can fight off many of the bacteria and viruses found on skin and lungs. However, a person with Job syndrome will have a much harder time fighting off these infections and will constantly need antibiotics. Like I mentioned earlier, Job syndrome is an autosomal dominant disease, which means that when the person has kids, that kid has a 50% chance of getting Job syndrome as well. There is no cure for this disease, but treatment consists of supportive care. So that means getting antibiotics as prophylaxis of getting any infections in the future and a topical moisturizing cream for the eczema. There isn't a lot of information on this disease, so I'm really glad that I have someone willing to talk about what it's like having it. There is a Facebook support group that has about 800 people in it, but there's only about over 200 cases documented in medical literature, as the rest are maybe misdiagnosed. Before we get to the guest, I just want to say that if you're listening to this podcast and you're enjoying it, please leave a review if you're listening to it on Apple iTunes, as this really helps me get more recognized by other people when searching for my podcast. So if you could do that, I'd really appreciate it, and thank you. In the show notes below, you'll find websites about hyper IgE syndrome, other primary immunodeficiencies, and also a Facebook support group for people who have Job syndrome as well. Our guest today, Dusty, tells us about how she's had severe eczema since she was 6 years old, having her baby teeth removed, and having 2 collapsed lungs, all while not even knowing what her diagnosis was until a smart allergologist figured it out. So, without further ado, let's listen to Dusty and her story with what it's like living with hyper IgE syndrome. Hello, Dusty.
Hello.
Hey, how are you? This is Robert from the Patient Will See You Now podcast. How are you?
I'm doing really well. How are you?
I'm doing fine. Thank you for asking. So, Dusty, I explained a little bit of what hyper IgE syndrome is already in the beginning, or Job syndrome, and I'm really excited to have you on the show today. And let's just go right into it. How about you let the listeners and let me know, how did this get started? When did you notice something was different, and when you were diagnosed? And we'll just kind of take it from there.
Okay. Okay. So, I grew up with all of the symptoms of Job. So I look back now and I can go, okay, well, I was literally the poster child for stat 3 Jobs because there's types. And um, I I just thought it was little quirks about myself. I just thought that everyone had allergies or everyone had like severe eczema or um, that my joints are hypermobile. So when I run, this sounds horrible. Um, my legs will actually go out instead of behind me when I run. And I didn't notice that until my daughter was little. And some people I know said, she has your run. And I was like, well, what does that mean? What do you mean she has my run? Well, they had to show me and explain it because I can't see myself. Um, so I had all of these symptoms, like my baby teeth didn't fall out, and I had a lot of them removed. But I thought it was just little things about myself. So I actually was diagnosed on March 30th of 2015 on accident. I collapsed my right lung on November 13th of 2014 is when I had my first surgery. So I had pneumonia for a while and I just had a baby. So he was 4 months old. And now I can look back and say, okay, I'm pretty positive I was sick while I was pregnant, but I was so miserable. And now I can see that I flared with each of my pregnancies. So I didn't notice a difference. I was super sick. So I was sick, but my mother-in-law actually was very ill and she had an aneurysm. So I couldn't really get anyone to listen to me that there was something wrong at the time because everyone was focused on my mother-in-law. And I had seen my family doctor, I think 4 times at this point, and I just kept saying something's wrong. My hair was falling out. I had a horrible fever of like 103, and I had been this way for like 2 months. I lost like 50 pounds in a few months' time, and I could not breathe. Walking up a set of stairs would make me winded, and I just couldn't catch my breath. So I kept seeing him, and then he just kept giving me like new inhalers, and it wasn't making it better. So I ended up calling again, and he was not in office, but I saw the other doctor in office. She was amazing, and she asked me to come in, and she checked my thyroid, and that wasn't it because a lot of the symptoms related to your thyroid. And then she said, well, let's see if your pneumonia went away. So she sent me for an x-ray, and I went and did the x-ray, and the x-ray technician told me I had to talk to my doctor behind the screen, behind the glass. She said, she's on the phone for you. And then I knew something wasn't okay. I was like, nobody makes you go talk to your doctor behind the glass. So I went back there, and I got on the phone with her, and she said, I need you to drive back here because I need to talk to you right now. And so I took my baby, because he was 4 months old, and we drove back. And that took me a bit of time, because walking from the hospital where the x-ray was back to my car, I had to stop like 3 times because I could not breathe. So I got there, and I talked to her, and she sat me down, and she said, I'm going to leave you a few minutes because you need to make arrangements, because you have your baby with you. And she said, but I need you to call your husband and call anyone else. And as soon as you are done, you're going to go to the hospital and you're going to go have surgery. And then she explained to me that my pneumonia had spread. I collapsed my right lung, and I was in a really dangerous spot. So I called my husband, I called my stepmom, and my stepmom got my kids from school, took my baby from me. My husband obviously left work and started rushing down to the hospital, and I went and did surgery. I was ecstatic because someone finally listened to me. But after they sent me home, and I was on a PICC line for a month, and I did everything I was supposed to, I went back to my house. I was finally allowed to go back home. Before then, I was staying with my stepmom because they all agreed I couldn't take care of myself, let alone my kids. So I needed to stay somewhere else. So a month later, I looked at my husband and I said, I can taste metal. And my ribs were hurting again, and my shoulder blade was hurting again. And so the next morning, we ran to the hospital to go do an x-ray. And they sent me in an ambulance to another hospital, and I had collapsed both my lungs this time. So I've had an eventful journey.
Yeah, no kidding. This is a lot so far. Collapse one lung and then collapse both lungs afterwards. Oh,
Yeah.
okay. So let's
Yeah.
continue from there.
Oh, I'm pretty sure most people do not find out the way that I found out. So I went and I did my second hospital stay, and that point I was afraid. I wasn't afraid the first time. I was like, okay, someone caught it, I'm okay. But the second time, I had a doctor sit on my bed, and he had a dry erase board, and he drew out my lungs and drew out like what it looks like. And he showed me that the infection was actually wrapping around my heart, which is why my heart rate was so high. They were worried I was going to stroke out. And so he said, had I not been there in the next couple of days, I wouldn't be here at all. So that sent me into panic mode, because I had 3 kids at this point, and I just had one. And I didn't grow up with my biological mom in my life very much, so I didn't want to leave my kids in that manner. So I did my hospital stay. I asked them for another PICC line because they kept blowing my veins out doing IVs. And I was like, can we just do a PICC? We all know you're going to send me home with one. So I got another PICC line, I went home, and my stepmom at the time just kept reiterating to me, you need to go and get rid of your dogs because your dogs are making you sick. It's got to be your dogs. We all know you have allergies to dogs, so you need to get rid of them. And all I kept thinking was, I lived with my dogs in other houses and I never got sick. So I didn't understand why this house that we had just moved into, probably 8 months before that, why they all of a sudden are making me sick now, but they weren't before. So I decided to find a new allergist that was around the hospital, because all my other new doctors that I was seeing was at this hospital. So I went and found him, and I did another allergy test. And my second appointment is when I got to meet him, which was March 30th of 2015. And he walked in the room, and he had my charts because all my stuff is Cleveland Clinic, so he could see everything from my hospital stays. And he walked in and he said, I have some questions. And he said, did your baby teeth fall out or did they not when you were little? And I said, a lot of them didn't know. And do your joints bend more than they should? And I said, I don't know because I've never really paid attention. So then he tested my joints while I was in there. He asked if the arch in the roof of my mouth is higher than normal. And I was like, I don't know, because who looks in people's mouths to go look? I mean, I don't really go and check people's mouths, but so he looked in mine and he said, yeah, it's higher. And I have a wider nose and a higher forehead. And he asked if like I had skin conditions or eczema or skin infections, which I grew up with all of those. I grew up with cysts all the time when I was a kid and I just had to get drained. I actually had a surgery when I was 6 to have a double one removed because it wouldn't go away. I had really horrible eczema and I remember crying when I was little because it was like my skin was extremely itchy. It was like I couldn't make it stop and I used to scratch until I would bleed. So they, my dad and my grandma and my stepmom used to wrap my hands in socks and duct tape them on my hands when I went to sleep so I wouldn't scratch. Yeah. But now he looked at me in this room and he said, what doesn't make sense is your skin's not bad now. And I said, I don't know. I have no idea. They just told me when I was growing up that I might outgrow some of my skin stuff, and I did, which I guess doesn't make sense for most Job's people. So they're now really confused on why that worked for me and it hasn't for others. But so he said, I know what's wrong with you and I know what you have. And for me, that was the biggest relief because I just kept going back into the hospital and I didn't know what was sending me there. So I was just afraid, well, what if I keep collapsing my lungs? Or what if I don't make it this time? What if I don't get to come home again? But I didn't know what was causing it. So he told me what I have. And then my new family doctor, because my surgeons in the hospital told me I needed to fire my family doctor because he was the reason I collapsed my lungs.
Ooh.
He did. Yes. Yeah. He didn't do testing. He didn't do testing on what I kept coughing up, which would have given him the answer on what I needed to take medication wise. And he never did it. So they told me I was not allowed to see him anymore. So I had to get a new family doctor, and I felt really bad for that guy because I just got out of the hospital and I gave him all of my information, and he was a student doctor and he looked overwhelmed. I apologized so many times, but he was so nice to me. He showed me my CT scans, and so I could actually see them do their job on the screen. And he explained to me what that meant, and that just made me feel so much better to know what I was looking at. And then he said something that stuck out to me. He said, every time you get hospitalized, your body has an allergic response to something. So something is making you have an allergic response. And now we need to figure out what it is. So I found out later that the house we were renting had a little bit of mold in the basement, and we didn't know. And apparently Jobs and mold are like enemies. Like this is not okay. So I've been told since then, like, I'm not allowed to go rake leaves. I'm not allowed to go play in mulch. I'm not allowed to go planting things, like planting plants or trees if there's mulch around. No rolling in the leaves with your kids. My immunologist says that I have to wear a mask if I want to do anything around mold in any way. And I didn't even know that leaves had mold. So he knows this now and he glared at me, but I told him after he told me I wasn't allowed to do things, and I had to come to terms that the life I knew was gone and the life I have now is different. It's like grieving the loss of what you knew. So I purposely went and raked leaves because I was mad.
Okay.
Because because I'm stubborn. Um, so now I don't, but I was not in a good place then. So that's how I found out I have Job's. And then it took them a few years to do the genetic testing and get that squared away, because the first test actually came back negative. And then he sent me to another immunologist, which is like, I guess he's like a better, more world renowned immunologist here where I live. People come from all over the world to come see him. And even he was confused on why my test came back negative. So they had to narrow it down and test me again. But it came out.
So so is that where we're at now?
Um, n- Now I do pretty well now that I know what to look for, what symptoms I have to watch for. I still have some like hospital PTSD. Like if I taste metal, that's like a trigger for me now because it was so traumatic.
All right. So I'm going to take it back a little bit to the beginning before we go to what's happening now in the future.
Okay.
Just a few questions. One is your baby teeth didn't fall out. Now that's pretty interesting in itself. So did you have to when did you have to take like surgeries? Did you go see the dentist and they were like, why are these baby teeth still in here? They need to get out. Like how did that look like?
Okay. So I saw a dentist, and I remember once I had to have three of my canines pulled in the same day, because the adults were coming in, but the babies were not moving. And they left my fourth one in because the adult wasn't coming in yet. And I remember arguing with my dentist and my dad that my teeth were not coming out. Like, there is no wiggling to make it come out. It was solid, it wasn't going anywhere.
And how old were you at this time?
I think I had some removed when I was little, like your front teeth. I think it was like my front bottom teeth I had removed. And then I had a couple molars removed when I was in my teenage years because they weren't coming out. And my canines were removed probably around 14, something like that.
14.
Like they should have been long gone,
Yeah.
but they weren't.
So is that when
um,
you were arguing with your dentist and your dad like, "Hey, they're just not coming out. They need to get out now?"
they they were just dead set on they will come out when they're ready, and I just kept thinking they're not moving, they're not wiggly, they're not doing anything. And I actually had the same argument because later I tested, in the last few months, I've tested my four children. And my daughter had a lot of my same weird characteristics. And again, I didn't know. So I just thought that she had my weird quirks. And I argued with her dentist as well, because her teeth didn't fall out either. And I just kept saying, no, she's like me. They don't come out.
And did they just kind of look at you funny like, no, are you that's not how it works. They will come out." Or
Yes,
did you have
like
to
they didn't.
explain to them what Job syndrome was?
I didn't know what Job's was yet.
Ah, okay.
So yeah, so now she's 15, and we're going through this now where she has a bunch of baby teeth, like 9 baby teeth that are still not gone. And they don't want to pull them all out at once because they're afraid that her adult teeth won't come in,
Hmm.
and he called it like cottage cheese mouth. Like she's just going to have all these holes and then they won't fill in properly. So we're going like one or two teeth at a time and then hoping her adults come in. Um, Unfortunately, some of them don't seem to be coming in, and now they are discussing dragging her adult teeth down, which sounds horrible.
Is that something that you had to experience?
I didn't. Mine actually dropped down. They just took a while. But my baby teeth didn't come out, but my adults came in. They just didn't come in on time, or they
Do you
took
currently have any baby teeth, or are they all gone now?
they're all gone. I actually have braces right now at 34, because one of my teeth wasn't pulled in time. That was because no one wanted to listen to me again. And so my canine, when it eventually came in, it came in behind the rest of my teeth. So now I have to correct it.
Which is absolutely understandable. Just I'm guessing the other people who have Job's syndrome, they probably have to go through the same thing, getting their baby teeth removed, and later getting braces later on in life, just to make sure everything's straightened out, and then no overbite, underbite, anything like that.
Yeah, I have an overbite,
So
which I guess is pretty common.
so does your dentist now? Was he surprised with the diagnosis, or was he like, oh, I've heard of that? I don't know why I didn't think of that before.
Okay, so none of them have ever heard of it. Um, my dentist was like, okay, and then he just looked it up, and now he knows like he needs to watch for infections or pay attention to what's going on for me. For my daughter, her pediatric dentist, her when she flares, her bottom front teeth try to fall out, her adult teeth. It's like her gums get all inflamed and then her teeth try to literally fall out. And so they said they didn't know what to do for her anymore. They were like, I don't know what to do. And she was in the middle of this process of her teeth trying to fall out, and she's not eating. She hadn't eaten in like 3 days. And her mouth, she looked like a little old lady with like dentures, like the way she was holding her mouth.
Oh no.
Like, so so they said, well, we don't know what to do for her. And I actually called my old family dentist when I was a child because I had taken her there before, and I said, I need someone to listen to me because she's going to lose her teeth. So he said, well, she's already been a patient here, and he actually told me to come in with her right then and drive from, it was like 30 minutes away, but he looked up Job's while I was on the phone, so then he knew how to treat her, and she has stayed with him since. She refuses. She's like, Mom, that's the dentist for me.
Oh, well, that's awesome. At least you have a dentist that like really took his time and gave in some initiative to look up what kind of signs to look for Job syndrome, and who knows, maybe he'll now be a specialist for people's teeth who have Job syndrome.
Maybe. I was just excited someone listened.
I'm sure that gave you a lot of reassurance then that somebody listened to you, like, hey, this is Job syndrome. They're like, oh, you are absolutely right. That probably gave you a lot of like just that really good feeling, reassurance feeling that someone listened to you, that this is a real thing.
It was nice because generally people are like, well, I don't never heard of that. Um, I don't like I've never heard of it, so it's not real. I've heard that multiple times. And I'm like, no, it's real. It's a thing.
So going back now to November 13th of 2014, you had a 4-month-old baby and you had a collapsed lung due to
Yep.
pneumonia. Did the doctors, did they just think like, oh, this is another case of pneumonia and your lung collapsed? Uh, so you're probably about what, 30 years old, 29 or something like this.
I was 29.
Did they say like this is really strange for a 29-year-old to have a collapsed lung, or what? Do you remember what they were saying at the time
Yeah,
then?
they said it's abnormal for someone my age to have their lung collapse the way that mine did, but no one looked further. They were just, doing the chest tubes and um, trying to get through it, I guess. But no one looked further. No one asked questions.
What was your experience like then? Because yeah, I just realized you had to go through the whole operation, get the lung re-expanded again, have the chest tubes and drains, all of that. What was going through your head at the time? And you just had a baby as well. What was going on in your mind at the
I
time?
did, and I actually had my surgery on my daughter's 10th birthday.
So what was going through your head at the time?
Well, guilt. I felt really bad because I have never missed a kid's birthday, and this was my daughter's 10th birthday.
Hmm.
So I was like, well, crap, I'm kind of sucking as a mom right now. Um, then I was excited because someone finally listened enough to catch it because I just kept saying, I'm not getting better, I'm not getting better. I My fevers were so bad that I would like sleep on the couch because I couldn't walk up the stairs anymore. I couldn't breathe to make it up the stairs. So I would sleep on the couch, and the couch would be soaked from me sweating. And I started like coughing up blood because they said that I ripped the tissue in my throat from coughing so much. So I actually would spit out like bloody phlegm, I guess.
Geez, that sounds
And
like
my
you were going through so much at such a young age already. And then they that's it's strange how they were just like, "Oh, you have a collapsed lung. We're treating this. As soon as you get okay from this, we're sending you off." Even though it's kind of strange that you're pretty young for getting this, we're pretty sure this isn't going to happen again.
Yeah, I was told that I should be fine. And then later, when I collapsed my lungs again, I found out that the infection never completely went away. But they didn't ask me to come in to make sure. They did a month of PICC line medications at home, and I had nurses come in and see me every day. But they figured that, well, a month is like, I think it's a week longer than you're supposed to go. So they figured I would be good to go, but no one checked me.
So understandably, because Job's is such a rare disease, no one with a person with pneumonia, because we do see it quite often in the hospital. It is fairly easy to treat, especially in younger people. We just kind of give them the antibiotics. We re-expand their lung when if it does collapse, and usually it's pretty straightforward. We give them antibiotics and they go home and it's fine. So it's really hard to see if somebody like you who has Job syndrome to see that this is going to happen again. That's why I'm at the time I'm sure that's what they were thinking as well. That they were just like, oh, this really shouldn't happen again. Hopefully, this is just a weird one-off and that's it.
Right. I think that one was when I had the pneumothorax. I'm pretty sure that was what it was called, because one hospital stay I had a pneumothorax, and the second one I had a pneumatoceal.
And then you went to the family doctor 4 times. Your hair was falling out.
Yeah.
What was going on here?
Later I found out it was from the infection. It was my body's response to the infection. So my hair was falling out, and I had lost like 50 pounds in a matter of a few months. I wasn't eating. I couldn't eat because I would just keep puking it back up. Um,
But that's not
Now
necessarily from the Job syndrome. I think that, like you said, that's the doctor saying that that was your reaction to the infection.
it was the infection, but they said like it partially could be my body's response because of the Jobs. My body like blew it out of proportion.
Okay.
It's kind of what my body does. So,
What else were they saying when you told them that you lost 50 pounds in a few months? Because that's a very drastic drop in weight.
it is. It is. They just figured it had to do with the pneumonia and the infection, and just continued, with the chest tubes, and no one looked into it.
And the new inhalers and everything. Were the
Yeah.
inhalers slightly helping?
They helped a little with the breathing, but I still couldn't breathe enough to go up the stairs, or I couldn't walk out to my car without stopping to catch my breath. I couldn't make it to my car. So they weren't helping enough to notice a difference.
And now after all that, you went to go see this new doctor, and they tested your thyroid. They said that it's nothing there, and they did this X-ray, and what you were explaining here just sounded pretty terrifying. This whole moment here, where someone called you from behind the glass. Is what was this situation like? Someone called. What was that?
The X-ray technician came, and after she did my X-ray, and they make you stand there for a few minutes to make sure that they did it accurately. She came out and she said, "Your doctor's on the phone behind the glass. I need you to go talk to her." And that moment for me was like, okay, something's really wrong.
Did she see the
Because
X-ray already? Is that what happened, or?
yeah,
Oh,
yeah, she already pulled it up on the screen for her, and she didn't even have to send it off to go get looked at. She could already see herself there was a problem.
so I can only imagine what you were feeling. That like, oh, this doctor is already on the phone wanting to talk to me as soon as I just took this X-ray.
Yeah,
Uh,
yeah, it was I was kind of terrified.
And and the words she told you, she just said, "Come to the doctor's office right away." Is that what it was?
Yeah, she said, "I need you to come see me right now."
And you do that. You go to her, and she and she says, "Call your family because you're going to get surgery right now."
Yeah. She said, "You need to make preparations. You need to figure out who's got your kids," because she knew that I had multiple kids. So she said, "You need to make preparations. You need um, to call your husband, do whatever you need to do. I'm going to give you 10 minutes to sit in here and make phone calls." So she left me in the room to make phone calls. So people could, pick up my kids from school, or I could get a hold of my husband or whatever. She said, "But you're you're going to leave here and you're going to go straight to the hospital and you're going to go have surgery."
How long was that after the first collapsed lung in 2014?
For the second hospitalization,
Yeah,
it was about a month.
just a month apart.
Yeah,
So
and I had collapsed them both.
this is around the middle of December of 2014.
Yeah,
That
I think
what was going
he
on
was
through your
like,
head then? You just had one collapsed lung a month ago, and now you're being sent off right away to surgery to get your collapsed lung, which happened again, to get reoperated. Oh my goodness, I can only imagine what was going on through your head.
well, the second one, um, we were in my living room and my friend was there and I'm sitting with my husband, and I looked at him and I said, "I taste metal." And he knew that that was a symptom I had dealt with for a couple months when I was sick. And I said, "I taste metal." And he looked at me and he knew that I was afraid. And I said, "My ribs hurt." And he said, "Okay." So we went to another hospital because I refused to go back to the first one. um, and they said, "We are going to put you in an ambulance and send you to a better hospital." So I was shipped to a third hospital, and I went in there, and the the ER doctors, or the ambulance drivers, they actually laughed and they said I was the happiest person they think they've ever seen in the back of an ambulance. and um, and I said, "Well, my theory in life is I can be sitting here and I can freak out and cry, but that's not going to solve my issue. Or I can try to see the positives, and at least I caught it. At least I saw it faster this time." So I was just back there telling jokes to the ambulance driver.
Well, I'm sure they must have appreciated that because having a hysterical patient in the back of an ambulance just doesn't help anybody. So I'm sure they've appreciated to have somebody like you there as well.
It's just kind of how I deal with it. um, so when I got in the hospital that I was going to have this surgery in, a nurse actually came in and explained the surgery and how this is going to go step by step. So I was already afraid because I knew that this was happening again. And then she came in and explained it, which made me more afraid. And then I had a fifth year surgical resident come in who is going to do my surgery. And he told me that I was going to be awake for my surgery. And then I panicked.
That's completely
So
odd. You were awake for the surgery. Did he explain why?
that's how they do it. He
Okay.
said that they were just going to leave me awake. Um, but my heart rate was already too high because it
Well,
had wrapped
getting all
around my
these
heart.
news, I'm sure that's understandable.
Well, it was already too high from the infection. But then when he said that I had to be awake, then I was really afraid. So they had me hooked up to things and they had my heart rate out in the hallway. So the main doctor out on the floor could see everyone's heart rates in the hallway. So he saw mine skyrocket up, and then he came running in and asked what was wrong because they needed to get it down. He said that they were afraid I was going to have a stroke if my heart rate continued where it was. So they had to get me to calm down. And I explained what he said, that I have to do the surgery awake. And he was like, okay. So he calmed me down and he said, don't worry. And he pulled him outside. And I don't know what was said, but I heard yelling.
Okay.
And then the surgical resident came back in and apologized and said that they would be putting me on something to, um, it would be like the equivalent of like LSD. Like I'm not fully asleep, but I'm not awake.
Like halfway there. Yeah.
Right. So, I mean, that was okay. Um, but I was still really afraid. And so for that surgery, they allowed my husband to be in the surgery with me and to hold my hand,
Oh, that's nice.
which is like unheard of. No one lets people in surgeries.
And were there any like funny experiences there? Did your husband say like, "Oh, you said the craziest stuff during the surgery" or anything like that? Or and he had to watch the whole surgery? Is that how it worked too?
Yeah, he held my hand through that chest tube. I had another chest tube placed a couple days later for the other lung because it was only partially collapsed, so that one wasn't as big of a deal. But he stood there and he went through this whole surgery with me holding my hand, and he actually explained to them what I was saying when I was coming out of it because they couldn't understand me because I'm a lightweight with medication. And I tell everyone that I'm a lightweight. Please don't give me the normal dose. But they always do. And so they were like, what is she saying? And he said, she wants to sit up. And they were like, what? And he said, it's painful for her to be flat right now. Please sit her up. And so they sat me up. And then he said, they just saw me go, well,
That
laying
sounds like a
down, the
wild ride.
pressure,
Yeah.
well, the pressure on your lungs when they're collapsed, when you're laying flat, is really painful.
It's just really tough. Okay. Ah, that's actually not something I thought of. So when you're lying down with those collapsed lungs, it's actually for you, is it just harder to breathe as well?
It is harder to breathe, but it feels like someone's like pushing on you,
Hmm.
and it kind of feels like someone's stabbing you. Like it is excruciatingly painful.
Well, I'm hoping they
So,
gave you some stuff for the pain as well at that time.
well, yeah, yeah, but they had to lay me flat before they did my surgery, and I didn't have pain stuff in me yet.
Gotcha.
So that was not a happy moment.
So you had the first operation, you had the second operation with your husband holding your hand throughout the whole thing. Great guy.
Yep,
Already like him. You go home, your stepmom's yelling at you, get rid of the dogs. You're like, I don't think it's the dogs. She's saying it's definitely the dogs. And you're like,
yep.
it's not the dogs. And then you finally see an allergist doctor. And after the second visit,
Yeah, it was my second visit because the first one is when they just did my allergy test, so I didn't get to meet him yet.
and then
So the second one,
he comes in and he says, I think I know what you have. And he started asking you all these questions. You were like, yeah, definitely. No, I've never looked inside other people's mouths before, so I have no idea.
yep,
Which makes sense. I haven't, like if if I wasn't in the medical field and someone asked me, is your mouth the same as everyone else's? Is it normal? I would just be like, what are you talking about? Like,
I feel this is a fair question. Like,
am I supposed to know what other mouths are they feel like?
right?
Or
Like I don't go look in people's mouths. I don't know.
and this is when he asked a lot about the eczema and the cysts and infections. And you said that
Yep,
you've had a lot of these throughout your life.
yep.
And it wasn't
Chronic.
it wasn't at the moment, but throughout your life. Can you explain a little bit more of what kind of things? Like I know you had the moment where your hands were wrapped up in gloves and duct tape so that you didn't itch, but what else was going? Like what kind of things were going on? Did people say different diagnoses? What was this surgery like that you had at 6 years old?
Okay.
More on those things, yeah.
I had a double cyst under my left armpit when I was like 6. And it wasn't. They put a drain in, but it wouldn't go away, so they had to go in and surgically remove it. And uh, other diagnoses. My lung doctor that I had obtained from this wonderful time, like, I st- he's really nice to me, and I appreciate him now. It took me a while to adjust to him because he has like it's like a dry sense of humor. I was pretty terrified of him for a while because I thought
Okay.
I thought that he's going to give me bad news, and my lungs were already like I was just already afraid of my lungs now at this point. I was just scared. I was scared of getting a cold, of because if your nose gets stuffy, I was afraid that if you have drainage go down your throat, and what if I can't breathe for a second? So for me, like not being able to breathe was like really terrifying for a little while. So he was wondering if I had lung disease. And then when I met my immunologist, he was like, that doesn't make sense. That doesn't make sense for everything else that's going on. That just would cover your lungs.
Hmm.
Then they talked about bulla
Yeah.
um, on the lungs because I have air pockets on my lungs now. So my left lung now has completely healed. And my right lung has healed like 3/4. I still have some healing to do, but they are impressed because they didn't think I would heal as much as I have. Um, when I was diagnosed, I started reading and researching and studying and what can I learn? What can I change? What do I need to change in my life? Um, I'm very proactive. So someone in my support group, I found a support group um, on Facebook, and someone brought up autoimmune protocol,
Okay.
AIP. Okay. Because I didn't know that I was immune deficiency. No one actually explained to me what all that was. I was told by my immunologist, do not go online, do not research things because you will freak yourself out. So he gave me a little packet of papers, and that's what I was handed to figure it out. Um, so I found a support group. I thought it was an autoimmune disease because no one explained to me that it wasn't. And then it took me a little while to go, oh, it's not an autoimmune disease. This is something I was born with, and it's not quite the same. So I scrapped out AIP or autoimmune protocol because I figured out that is really hard to do when you have a family of 6.
Yeah, I can imagine.
So, so because the number probably doesn't add up to you. So after I got hospitalized the second time and stuff, pretty much immediately the month that I was diagnosed, I had kept asking people about birth control because I had just had my baby.
Hmm.
And I was like, can we talk about that? Because I know that you're really fertile after you have a kid. And I'm really fertile anyway. So, but no one wanted to talk about it. None of my doctors wanted to discuss it with me. They said, we're just going to try and make sure that you're stable, but we're not going to cover that topic at all. And we used protection, but I still got pregnant.
Okay.
So I had another baby, and then I was told during that pregnancy, like they were I had all my doctors sat me down separately and said, you need to contemplate your options because you might die having this one. So that was
Oh
a
wow.
whole new arena. I did have him, by the way. I had amazing um, high risk pregnancy doctors, and they were with me through all of it. And I had ultrasounds every single appointment. They wanted to know how we were doing. So they were amazing and helpful. And he's good. He's small, and sometimes I wonder if that is because I was still healing. I'm not really sure how that works, but
And you mentioned earlier that from each other pregnancy you kind of had what you called a flare up. Did you have a flare up
yeah,
with him as well?
yes.
And what did that
And
entail? What does a flare up have?
for me, a flare up when I'm pregnant is different than a flare up when I'm not pregnant. It took me a while to figure it out.
Okay. Could you explain
But
both then?
okay, so when I'm pregnant, I cannot breathe through my nose at all. It's like my sinuses are inflamed and stuffy, and I cannot smell. I cannot breathe through my nose. So that's like 10 months of not being able to breathe. And then my skin gets worse. Like I get eczema all over and my joints hurt more and the fatigue is worse than normal, which I don't appreciate. Um, just overall, it's not a great time. Flaring when I'm not pregnant is, I would say, fatigue is my worst symptom. Um, I've asked other people that have illnesses, if you could choose one symptom to get rid of if you had to keep your illness, what would you choose? And almost everyone hands down says the fatigue. They would choose that to go first.
Okay.
Um, I explain it as like a battery theory. There is a spoon theory, but that's really hard for people to understand unless you're sitting in front of them with a handful of spoons.
Okay.
So, um, a, a breakdown of that, I like the battery theory better myself, but the spoon theory is basically like you wake up in the morning and you lose 2 spoons because you have to wake up and getting dressed as a spoon and taking a shower as 2 spoons. And by the end of your day, you're contemplating like, do I make dinner or do I spend some quality time with my kids because you don't have enough spoons to do both.
Okay. Well, okay. I understand that.
Okay. So, but the normal people that are not doctors and are not ill like me would not really grasp that unless you're explaining it in front of them. So I kind of adapted it so people would understand it better. I say, look at it like you are a phone battery, because everyone has a cell phone. And when you wake up in the morning, you are 100% charged. When I wake up in the morning, I'm like 70% charged. So then when I go through my day, when I have to get dressed and I have to make breakfast for my kids and I have to get them off to school, and if I have errands to run that day or whatever, like my battery is draining much quicker than yours would. And when I'm flaring, my battery's probably starting out at like 50, 60%. If it's a bad flare, it's much lower. um, I've had to explain it to my doctors that if I'm in a really, really bad flare, then it's like I can hear my kids down the hallway saying, Mommy, can we get up now? Because I have a 4-year-old and a 5-year-old,
Hmm.
but I cannot move. I cannot get there. I cannot open my eyes. I physically cannot make my body do what I want it to do. And that I only hear them for a few seconds before my brain shuts back off and I go back to sleep. And I don't have a choice in it.
So would you agree? Would you, if you had to pick a symptom, it would be the fatigue to get rid of?
Hands down.
Hmm.
Hands down without a question. Can
Fatigue
take
is definitely one of those things that a lot of people just don't understand. They just think like, after a hard day of work, that could be fatigue, but fatigue is, amongst there's a lot of diseases that has that fatigue is one of the symptoms that goes along with it, and people just don't, and myself included. It's really hard to imagine what that level of being tired is like all the time.
um I have fallen asleep standing in my living room. I will be standing and I will be sleeping because my body quit and I don't get a choice in it. It just stopped working. um I have bad days when my joints hurt and my fatigue is not great. And we're actually um, trying to sell our house in the next year because we have a 2-story house. And I would really like a 1-story house. So on my bad days, I will be standing at the bottom of the stairs, and we have 14 stairs to get to the second story. But I will stare at them and I'm questioning, how am I going to get to the second level to get to my bedroom? How am I going to get up 14 stairs, which to everybody else is like, okay, it's 14 stairs. But when your body's not working, 14 stairs is a lot. It's like a mountain. So my husband will actually walk up behind me and then he will be my support. He will come up behind me and let me rest on him and then he just helps me get up the stairs.
It sounds like you have an amazing husband with all of this. He's like your greatest support through all of this.
He, um, we have an interesting story. I've known my husband since I was 6. So we met in first grade. He was my best friend.
I was gonna ask if you met when you had that double sister moved.
No, no, no. We were in the same class together in elementary school.
Oh,
So I apologized so many times when I was sick because I felt bad. I felt bad that he had to go through it with me. I felt bad that like he was in college. He had recently before that a couple yeah, he had gotten out of the army, and um so he was in college and he was doing an internship, and he was working third shift, making donuts so we could get by until he could get done with school. But he couldn't quit any of those, and that was when I was hospitalized. So he was doing all of those things while I was in
plus
the
being there
hospital,
for you.
right, being there for me, and then keeping his grades up. He still graduated with all A's and B's through all of that, and trying to be a dad to the 3 kids we had at home.
Sounds like you got a keeper. He sounds
he's been
awesome.
really he's been really amazing in my journey, and he um totally we just did my first PI walk this last year. So he went with me and he did it with me, and they have conferences and stuff which I just learned about, and
What's a
he was
PI
like,
walk?
yeah. They raise money for primary immune deficiency people, so people like me where your immune system does not work like it should.
And it's like another fun.
So
It's like a fundraiser type of thing.
yes, so there's things like the lupus walk, and everybody knows what lupus is. Okay, well, not everyone knows what it is, but it's way more. Uh, People are way more aware of what it is than what people like me are.
Hmm.
So lupus has their own walk, and I know that because both of my biological sisters have lupus. And then people like me, we're all clustered in one walk because we are so rare. So we all have to be joined together.
Oh, they should be all separate. If lupus gets their own, they should all get their own.
We would never have people show up. There's not enough of us.
So I wanted to go back on the house because you wanted to get this new house, and then you someone mentioned that there was mold in your basement. Is that what it was?
Yeah,
And
in
this is
our
what was
rental house.
affecting your allergic reactions to it.
Yep.
Has the avoidance of that mold now helped you a lot?
We built our house because of that experience. We had our house built. Because when that happened, my husband was dead set on, we are not buying a house because you don't know what you're going to find. And what if I don't make it through the next one? So we had this house built, and we will have the next one built.
So after this one being built, though, has it? Do you feel like you have? Do you feel much better now with the mold not being there?
Yes.
So
Yes.
that's completely changed your lifestyle ever since then.
I do very well. I am on some, like, I'm on allergy meds, which they have to combine them to make my body not freak out, I guess, to all the things I'm allergic to. Um, my doctor does not want to add me on more medications because he says that I have made myself stable enough. He does not want to mess it up. So I switched my whole family to paleo because I found out that part of our issues are an inflammatory response,
Hmm.
and paleo cuts out inflammatory foods. Um, Probably 2, 3 years before I was hospitalized and all of that happened, I came across something called the pink method. And it was a diet specifically for women's bodies where she cuts out dairy and grains and whatever. And that actually led me to find out that I have reactions to foods. I didn't know I had Job's yet, but that showed me because my left eyebrow for like 3/4 of it was gone for like 5 years. and it was red and angry and inflamed, and I had splits above my nose, like the bridge of your forehead slash nose.
Mm-hmm.
I had splits where my face split open
Ooh.
and it would scab. Yeah, it's not fun. Um, both of my ears have split. Um, I don't know how to explain to you where that is. Like the little triangle on, look, where your ear connects to your face.
Okay. Yeah.
So I have a split there, which will never go back. I can actually like push down the little triangle flap, and because it's no longer connected. I found out that I have a really bad reaction to grains and dairy. So the pink method showed me that I have reactions because when I stopped eating them, my eyebrow healed and my face healed and it all stopped. And I remember sitting in a car crying because I would have people walk up to me and ask, "What is wrong with your face?" Or "What is wrong with you? You don't look normal," or whatever, because my eyebrow was gone and it was scabbed and I didn't know how to fix it. I didn't know what was wrong. So later, when I came across paleo and she explains the same stuff, I was like, oh, so it's my body's response to something. It's like my IgE levels are ridiculous.
Just out of curiosity, do you know like the highest number of your IgE? Because that is one of the hallmarks
I
for
do.
yeah. What was
I
it?
do. My last test showed 7,000.
Oof, that is a high number. Definitely. So actually, is so going back to your face and all the splits and the facial features that you mentioned, um, because that was one of the things in textbooks because they do mention this in the textbooks in medical school. It's one of those autoimmune disease that we learn in hyper IgE syndrome, and they mention that it's a very leonine faces, which is just a fancy word for like a lion type of face. Would you say you look as fierce as a lion, or how would you describe?
That's interesting. I've never heard it put that way. But I guess when you look at a lion's face, like their nose is wider,
Hmm.
and my nose is wider than, I guess, average people. I don't know. It's always been the way my nose has been. So, and then my forehead is higher than a lot of people, I guess. So when he met me, he said, "Oh, you have the characteristics." And I was like, "What?" And my daughter looks just like me. Like someone actually called her by my name recently, and I told her she leveled up. I said, "Before, people just thought you looked like me." I said, "That person that I knew growing up, he thought you were me. So look at you go."
Dusty, we're gonna wrap this up slowly, and this whole interview has been really interesting. Like this is all completely so different than most of the other diseases I've talked about on this podcast. And for all of my guests, the final question I like to ask is for somebody out there who might be listening and might have Job syndrome, aka hyper IgE syndrome, or if somebody knows somebody that has Job syndrome, what kind of advice would you give to those people?
Oh, that's hard. Um, I would say, listen. I would say listen because even as a patient, I have had doctors not listen to me. Not just my hospital stay, but people that knew I had Jobs not listen to me. Um, at this point, I am told to call my immunologist when I'm sick, and he calls me back from his house to send me prescriptions because my doctors were not listening. And I guess you have to be sick for 2 weeks before they will treat you. And then he got very angry and said, "That will kill you." So, so I wish medical personnel would listen or study more about what it is and not just assume that I am like everyone else because I'm not like everyone else.
Hmm.
My body doesn't work like everyone else. And if you are a main person in someone's life, like a family member or a friend, please don't assume that it just goes away like a cold. I've heard that so many times. If you just take more vitamin C, you'll be fine. No, I won't. It doesn't work that way. Um, and for a Job's person, if anyone is a Job's person like myself, please advocate for yourself. Please make them listen, because I didn't know how to make people listen and it almost killed me. Now I have a much louder voice and I make them listen to me, because I am not going to die because of someone else not listening. And support groups. Support groups are very helpful to have other people understand what you're going through, or to give you information. I have gotten information through my support groups that my immunologist didn't even know about. I gave him information for NIH, which is the National Institute of Health in America. And I gave him information on a group that studies my illness there. So I can get more help through them. But I gave him the information because he didn't know.
Dusty, that is all so amazing. I'm glad that you are really voicing everything, and you're the one teaching other people about more about Job syndrome, since you're living it, and it's so great. I really hope a lot of people listen to this and learn a little bit more about different immune deficiencies. And I know that in textbooks it says that people with Job syndrome, they have a leonine facies, but on top of that, if even if that's true or not, you have the voice of a lion now. You are telling doctors what they need to do and what they need to listen, which is great. I'm really happy about that. I love hearing your laugh throughout the whole interview too. Your laughter, it's giving me just this smile all the time. You seem like a lovely person. You have a great humor and a great attitude. Your support system is completely awesome. You have this great husband, and you also have this support group that you learn more about what you're going through. Dusty, thank you so much for being a guest on this podcast, and I really hope that a lot of people listen to this as well and take something out of it. Is there anything else that you want to mention before we sign off?
I don't think so, but I greatly appreciate that you gave me the time, and that you listened, and that you seem like a normal person, because I was so afraid. I thought like the interview was going to be scary, but thank you for just talking like we're just having a conversation, having coffee.
Those are some of the nicest words I've heard. Thank you so much, Dusty. I appreciate that.
You're welcome.
Thank you. I hope you have a good evening. All right, Dusty?
You too.
Take care.
Bye.
Bye. If you like this episode, please leave a review, and also make sure to subscribe or follow on whatever platform you're listening to this on so you can catch the future episodes as well. If you want to be a guest on this podcast, please send me an email with a background of what disease you're living with to thepatientwillseeyounow@gmail.com, and I'll let you know if you're selected to be on the show. Don't worry if I haven't gotten back to you right away, because I might get you back for a later show. And if your condition was already mentioned on the show, no worries. I like to show how one disease can affect different people in completely different ways. Again, thank you so much for listening, and catch you next week.